Hey everyone, it's Naomi Wolf of Daily Cloud, and I am really honored to be here with Dr. Patrick Phillips. Dr. Phillips, welcome.
Thank you, Naomi.
So,
Thank you for having me.
so I'm so pleased and honored, and as I just tweeted, it seems as if by default on my and our social media channels, the Daily Cloud, people are coming to us who have deep expertise in public health matters and civil liberty matters that are in the news right now with the lockdown. So Dr. Phillips is here for reasons that he will explain. He's calling in from the province of Ontario, Canada. So tell me why you reached out.
I can't say that I have a ton of expertise in one specific area. I'm a family doctor. I finished my residency training about 2 years ago at the University of Toronto. And since then, I've worked as a rural family physician. And what I can tell you I have experience in for sure is being on the front lines of healthcare. I mostly work in an emergency department in a small town about 6 hours north of Toronto. And and I can tell you that living through these lockdowns that we have here in Ontario, I'm seeing so many devastating impacts of them on the health of my patients, including mental health, cancer care, and basic care that has been severely impacted by these lockdowns. And I firmly believe that the consequences are strongly outweighing any benefit that they provide. After seeing this and seeing it just get consistently worse, I felt compelled to speak out.
Dr. Phillips, I thank you from the bottom of my heart for your courage. And I know many people watching are also grateful that you're taking your oath as a medical healer so seriously, and you're very bravely coming forward. I hope and I know that there are many physicians and scientists who are also coming forward, but you're really doing what you should be doing to protect the health of your patients. So thank you. So can you please give me some examples of where you're seeing the harms in lockdown manifesting with your patients? Just a few stories of real people, obviously with their names concealed.
Yeah. So one of the most compelling things that I saw was with regard to cancer care. In Ontario during the first lockdown that happened through April into May, there was actually a 40% reduction in referrals for cancer care in our province, and cancer did not go down. Like these people were unfortunately missed. And what a lot of people don't realize is that cancer, especially early on, has very subtle symptoms. It
Mm.
rarely is pain. Um, People generally feel okay. It might just start as a little lump, or it might start as a small signs of bleeding or something like that in your stomach or in your colon. And so they're very subtle, and we have to be very careful to pick those up and investigate them. And a lot of those investigations were severely delayed. And um, and what I noticed going through this fall is that I've seen a huge uptick in people coming into my emergency department for the first time with a bellyache, where I put an ultrasound on them and find out that they're riddled with cancer.
Oh my gosh.
And some of them are young people. Some of them just thought that they just had, yeah, like I said, a bellyache. But what's happened is that they missed cancer screenings. They avoided coming in because of the media saying that scaring them about COVID, basically. And a lot of them were afraid to catch COVID if they came into the emergency department. And the other part of it as well is that, at least in Canada, almost all primary medical care has been switched to what's called telemedicine, which is basically healthcare over the phone. And I saw one lady, unfortunately, who was uh, managed by telemedicine over the last year for what she called back pain. But when she finally came into the emergency department because her back pain was so bad, I laid hands on her and felt this big lump. And when I put that ultrasound on, like I said, it was just riddled with cancer.
God, Dr. Phillips, these are terrible, terrible stories, and how painful for you and your colleagues to know that, to have to share these serious prognoses with your patients, and
Yeah.
to know that if things had been operating as normal, it sounds like you would have been able to help, if not save these lives or make the quality of life much better. Is that correct? Like, would the outcomes have been better if they had come in earlier and you had been able to handle the process normally?
Yeah, I'd say for sure. It's overall, I would say that's definitely true. It's hard to say in every particular case if you could have changed it, because it depends when they would have come in. But for sure, there's just a huge uptick in people coming in and they have full-blown terminal cancer. And
I'm so sorry. Go ahead. I didn't mean to interrupt.
yeah, and it is sad, and just knowing that it's something that could have been prevented with the high quality care that we used to have in this province, in this country. Um, it's just something that's unthinkable in my mind, and that's among many other things is what tipped me over to know that I needed to speak out, and people needed to hear this, and to hear that there's harms from producing all this fear and from shutting down society and our normal healthcare system in order to just reduce COVID numbers.
Right.
Yeah.
So what you're saying is so rich and important and has so many implications. One of the things that jumps out at me is the fact that human face-to-face interaction and human touch really cannot be replaced by digital platforms in many areas, but one of them is in medicine, correct? It sounds like you're saying you can't just replace a doctor touching a patient and listening to a patient, picking up nonverbal cues, having that face-to-face intimate contact in confidentiality, which allows patients to maybe share more, share details they might be, nervous about sharing even on a telemedicine platform. Nothing replaces that. And when you were telling me the story of this poor woman who thinks she has back pain but has cancer, I'm also thinking about how lockdown has created isolation. Many people find out there's something wrong with them because a partner or loved one or family member says, "Mom, what's this on your back that I feel when I hug you?" Or and people are being forcibly kept apart from people who love them, who can notice when there's something wrong, or a doctor who knows their body, who knows their history, who can palpate as you did and find something wrong. Would you say, is this a correct conclusion that digital platforms cannot replace human healing in a face-to-face context? Is that part of the takeaway?
Yeah, absolutely. I think laying hands on a patient is so important. I think that digital solutions have a role in some things, but especially on the initial assessment of any medical condition, a physical exam is really important. But another thing that I'll plug in there around telemedicine is that from the patient perspective, it's even more important. So I think like the physical exam doesn't necessarily contribute a ton to establishing a medical diagnosis. In these cases, it definitely does. But in the patient's mind, they have not been seen by a doctor until somebody's laid hands on them. And so I've noticed so many people coming into my Emerge who, even though they've seen their doctor over telemedicine over the last year, they don't feel like they have. So they don't trust what their doctor's telling them. And I think that makes a lot of sense, because they're like, well, he didn't even listen to my lungs. He didn't even listen to my heart, right? So like, how do they know that what you're saying is actually right?
Are you saying that when people get direction on telemedicine from their physicians, like, gee, you really should come in, we need to rule out cancer or something, they don't believe it on a digital platform, which would make sense? Is that what you're saying?
Yeah, I think they trust that if you were like, you need to come in, we need to come examine you. Like, I think they would like that, right? They want to know that you're checking everything out for them. But it's more when we're doing the opposite, right? And saying like, oh, you're okay, this is nothing, just take this medication and you'll be fine. That's where I would say in a lot of people that they lose trust.
And what's the consequence of patients losing trust?
Well, when patients lose trust in what their doctor is advising them to do and the medications that they're prescribing them, they stop taking them, even if they're ones that they're supposed to be taking. So diabetes medications. And the other thing too is that I've talked to a lot of patients who said they don't even bother anymore. They don't bother even calling their doctor because they know they're not going to see them.
Right.
And so they've given up on seeking medical care. And so what ends up happening is they end up in the emergency department when things get completely out of control.
So Dr. Phillips, since you're serving in the emergency department in a small community, you really are in the front lines of seeing the harm of lockdowns as you describe it. You've talked about cancer. You mentioned diabetes. What are other ways in which you see lockdown policies where everything is subordinated to not catching COVID as having, fatalities, ill health, mental health? Name some other manifestations, please.
Yeah, so going to mental health, I can tell you one thing that is really concerning me is the mental health of children. I'm seeing a big uptick in depressed children, children living with emotional abuse, and suicidality in children in numbers that I haven't seen before. It's really concerning to me. I'm noticing, especially in the preteen age and teenagers, where children, their primary social support in those times is friends, right?
Yes.
It's a normal time to start to distance from your parents. It's normal to have fights with your parents, but it's not normal to be locked in a house with your parents, especially when you do not get along. So in seeing schools close down, children are losing their support. I'm seeing them give up. And I fortunately have the privilege of being in a hospital that has relatively low volume, so I can sometimes spend up to an hour, with patients and try to gain their trust and establish safety plans for them. But in a lot of places, when you go out to the emergency department with suicidality, there's not a lot that we can do there, right? And so except send you off to the psychiatric ward, which is not sometimes makes things worse for people, right? With all the stigma that comes with that. But it's not that these people, like these patients and these children, are coming in because they need medication for depression. Like, that's not what they need. What they need is that social support of having people that love them, of having schools open so that they can learn about who they are and make friends and have that social connection that makes life worth living. And that's what they're missing. So the solution to this is not even just getting them in counseling. It's to give them their lives back, right?
Well, exactly.
And, yeah. And so that's something that, again, I feel very strongly that I need to speak out against these lockdowns, because people's lives are being ruined by it.
What a good doctor you are. I mean, really, I'm really trying to kind of hold back tears because just as a parent, I know, I'm a stepmom, and I see my stepson losing affect, because he's not having normal human communication. I see, young adults getting depressed because how could they not be? We evolve to grow. We evolve to be in communication with other human beings. When you're speaking about these children and their suicidality, I really think a lot about research I've done on prisoners and how it's against the Geneva Conventions to keep people isolated and to forbid them to be visited by their loved ones. It generates, this is well established, that isolation, solitary confinement lead to permanent brain changes that manifest in mental illness and even psychosis, certainly self-destruction. And the other thing, so everything you're saying isn't just Dr. Phillips's observation. It's backed up by a vast body of research that if you want to make people permanently insane, you lock them up away from other human beings, which is exactly why the Geneva Convention forbids that as a form of cruel and unusual punishment in the criminal justice system. So what I also wanted to say is that it seems as if lockdown, there's so many things, and I'm not a doctor, but I think about my 80-something-year-old mom and dementia, and how dementia and Alzheimer's and many illnesses of the elderly are exacerbated by isolation and their immunities are lowered. Can you
Oh, yeah.
speak to that, please? Or can you speak to like what studies show being in human connection does to protect people from diseases that exploit low immunities? Did I put
Yeah.
that?
Yeah, so I think that that's absolutely true. There's well-established studies and medical literature on what are called the social determinants of health,
Right.
and and it's like this is something that actually is medical basics. It was drilled into us in medical school. So I find it crazy that nobody's talking about this in the medical community, because 75% of your health status is determined by your social determinants of health, not necessarily like healthcare, right? So your access to medications, that's on there, but that's actually pretty far down the list. So like in order, like they are generally income, again, another thing that is being destroyed by lockdowns, because income gives you access to freedom to meet your needs as you see fit. And because people know what their needs are best. So when people have adequate income, they live longer. They are happier because they're able to meet their needs. So people need jobs. People need to be able to feed their families. Like I'm seeing people more in my personal life, like who, like I have a friend who he's a hairdresser, and him and his wife are immigrants, and they have 3 young children, and they are having to eat Mr. Noodles now because their business is about to go bankrupt. We say that getting a haircut is non-essential. It may be non-essential to some people, but to them, giving haircuts is absolutely essential. Like no, like they're having trouble putting food on their table, and they're about to go bankrupt because of these lockdowns. And so income and employment, and no matter what it is, essential or non-essential, it's all essential because that's how people feed their children. So I don't think it's right to have any kind of delineation between essential and non-essential business.
That
Um,
makes sense. And you were also talking about, and these have been so well covered, even in non-medical literature, that human contacts, have a direct correlation with with how long people live and how healthy they are. Did you want to say more about that?
yeah, so that's another big social determinant of health. That there are studies that show that the more socially connected you are, the more connections, the more relationships that you have, the longer you will actually live.
Mhm.
The healthier you are. It lowers your cortisol levels,
Right.
and again allows you access to be able to meet your needs, right? Because you have people who are on your side. And so that human contact, hugs, releases oxytocin, lowers cortisol levels, which again increases your immunity. As well, humans are actually able to spread herd immunity by giving small amounts of viruses to people, but not enough for them to become infected, which
Which,
allows
sorry
which
to
allows
interrupt, Dr. Phillips.
yeah, which allows you to form an immune response uh, without getting a huge dose of a virus that will actually make you sick. So that's another thing that again people aren't talking about. Um,
Can I just jump in there
yeah,
and follow up on that? I am 58, and when I was in middle school, we learned about human immunity in exactly that way, that,
yeah,
from the history of vaccination and smallpox and how the milkmaids weren't getting smallpox because they had, a little bit of exposure to cowpox or,
yeah,
and how vaccination, in the 18th century gave you a little bit of the disease to give you immunities against an overwhelming infection from the disease. And
yeah,
that was like basic immunology in eighth grade,
yeah,
in the 70s and 80s.
yeah,
I feel like that common sense understanding of immunology has been lost. And everybody is talking about this virus as if there is no such thing as a human immune system. So
mhm.
in your dream world, given that there's a nasty virus out there, what would public policy be that would allow people to develop better immunities. I mean, that absolutely is my understanding of how populations work. It's why we change and adapt as there are new pathogens in our community. Am I wrong about this? And tell me what we should be doing immunologically as a result of your understanding.
Yeah, so in my understanding, I think we do need to have human contact, right? And especially allowing people who are at low risk, such as children and young people, to be able to spread this virus among themselves at very low risk of being harmed from it, right? And that will allow a sufficient proportion of the population to become immune, and then that protects the older and more vulnerable people from actually catching the virus.
How does it protect them? Because the narrative right now is you can't let kids touch each other because then they'll go home and kill grandma. So how does it, in your view, protect older people to let children circulate the virus?
So yeah, that's a good question. Yes, so children, are known to catch the virus and to spread it, but actually the numbers are really low, and it seems to be that with coronavirus, that children seem to be able to catch it and clear it in a very short amount of time, and most not even knowing that they even have it. But they're developing that immunity really quickly just because of their differences in their immune systems. But if enough young people actually catch it, then what happens is usually when a certain amount of the population catches a disease, it just tends to die out because there's not enough people for it to spread between. But there's another aspect, I think, of immunity that we need to be talking about as well, and that's some really positive research around vitamin D. So vitamin D insufficiency is extremely common in the northern hemisphere in the winter months because we don't get enough sun, and vitamin D deficiency is linked to COVID mortality. And there's studies that have shown that if you get back to sufficient vitamin D levels, the mortality from COVID goes way down.
Have you seen low vitamin D in your patients? Is this something you know about?
Yeah, no, it's so common in Canada and where we live that government just stopped allowing us to test for it, which I don't know if is necessarily right. But the reason is because everybody has it. Like, you don't even need to test for it. We know that there's not enough sunlight in the winter months in Canada to get normal vitamin D levels. So the government actually recommends supplementing with vitamin D for everybody. But it's usually not at sufficient levels. So they usually say like 1,000 units, but that's usually inadequate for most people.
How much should people be taking every day to protect from?
Yeah, so it's hard to give it an exact number, and the reason is because it's best to follow your levels, so to see your doctor and do that. But I would say generally between 3,000 to 4,000 units per day is what most people should be taking, but it should be customized according to what your levels are with your doctor. Yeah.
So can I just double check what you said, because it's incredible. It's one of the incredible, imponderable public policy decisions of this lockdown period. You're saying low vitamin D levels, which are very widespread, if not virtually universal in Canada in the winter, lead to a higher risk of serious outcomes if people get infected with coronavirus. Yeah. And that the government has recently said stop testing for low vitamin D levels. Did I hear you correctly?
That's not a recent change that we have here. Like, this is in our province, because vitamin D we typically just tested for osteoporosis and things like that. It's not, the government, I think, just stopped testing. It was years ago, actually. Gotcha. And the reason is just because they're just like, everybody should take vitamin D anyway.
Well, let me flip the question around then. In a sane public health policy with a pandemic like this, it sounds like, Dr. Phillips, you would highly recommend that kids and young adults be allowed to circulate or encouraged to circulate to protect everybody's immunity, certainly. But also in a sane public health policy, it sounds like I never hear public health entities saying, hey, everyone be sure to take vitamin D, be sure to get your vitamin D tested, get lots of sunlight, go hug people who you feel are safe to hug. Make sure you stay in healthy communication with people, go take a walk, go get fresh air and exercise. All of those things would measurably boost immunities and protection from this virus. Is that not correct?
Yeah. Yeah. And other aspects of it too that people aren't talking about is that we now know so much more about this virus, right? We know the risk factors for severe disease. One of them, we've talked about a few of them. So vitamin D deficiency. Another one is age, which we've talked about. If you're older, if you have comorbidities. And two of those are actually modifiable comorbidities. So a big risk factor for getting severe COVID, if you do catch the virus, is hypertension. And hypertension is something that is modifiable. It's something that can be fixed, and it can be fixed especially through exercise.
Wow.
And so going for walks every day, going to the gym, going for runs, those are things that can lower your hypertension, that drastically will decrease your risk for ending up in hospital if you catch COVID, because hypertension is a modifiable thing that you can prevent and keep you out of hospital if you catch this virus or any virus.
Right. Extraordinary. And here in Massachusetts, where I am right now, there is a universal mask mandate. And I was told that that includes on rail trails and along the seafront, where I would be miles and miles away from anyone. I'm finding that what that does, many people are finding, certainly true for children and playgrounds and exercise and basketball courts, which are locked down, right? It is a disincentive to try to get exercise if I have to wear a mask miles and miles and miles from anyone I could possibly breathe on. And, I've been tested and I'm very careful not breathing on, I'm always masked when I'm around other people because I accept the science of being 6 feet away, but it seems like madness to disincentivize people from getting exercise that can save their lives by mandating masks when there's miles away from anyone. What's your thought about that?
Yeah, absolutely. And I think another aspect of this that people aren't talking about is that there have been some massive studies, one coming out of Wuhan and another one out of the University of Florida that was published in the very prestigious Journal of the American Medical Association, showing that there is negligible and possibly no asymptomatic spread.
Right?
Yeah.
I keep circulating these studies and it's like talking to a wall, because the whole premise of lockdown is that there's asymptomatic spread, and there virtually isn't. So that's extraordinary. So basically, let's go back to your patients and the harms that you're seeing, because we could talk all day about the incredibly insane unhealth-related policies that are making people sicker, it sounds like. And you were going to mention another comorbidity. Was that obesity, or what's another addressable comorbidity?
Yeah, so the other one I was going to mention for sure is obesity. But there's another encouraging note that I want to plug on this. And I don't believe that if you have obesity that you need to lose all that weight to be safer. I believe the mechanism for obesity making you much more likely to get sick on COVID is something called insulin resistance. Right. And so insulin resistance is what causes obesity, and it also impairs your immune system. So it's basically like a precursor to diabetes, and it comes from carbohydrate toxicity, basically an overload of carbs in your system. Your fat cells become basically full and no longer will kind of it becomes harder and harder to get those carbs into your fat cells and turned into fat. But anyway, it's known to impair the immune system. Diabetes and prediabetes is a condition that impairs your immune system. But the good news is that you can reduce your insulin resistance just by losing that first 5 pounds, right? By things like intermittent fasting, switching to a ketogenic diet or a low carb diet, are things that are known to quickly reduce your insulin resistance, which will help to restore that immune response. And you don't need to lose 200 pounds. It's those first 5% that you lose off your organs. So losing that first 5 pounds and keeping it off will improve your immune response. And so that needs to be getting out there to
That
people. That
absolutely does.
yeah.
And I have to say, when I drilled into the death tables, I did not find COVID. It's virtually impossible to find COVID alone killing
Mhm.
people in the fatality tables. It's always with a comorbidity. And
Yeah.
that's how, I don't know about Canada, but that's how the CDC and the NHS in Britain are reporting deaths with COVID is always
Yeah.
a comorbidity. You can die from cancer, but if you've got a positive test, and we know there are problems with positive tests, we don't have time to get into those now, it will be listed as a COVID death. But it is virtually
Mhm.
impossible to find the number of people who have died of COVID alone. And when you do look at how, I mean, hard to find them as a separate category in the in the records that we have publicly available. When people have audited public records of deaths, as in Minnesota, two lawmakers audited the death certificates and found that there was a 40% over-reporting by including other causes of death. But absolutely, you mentioned comorbidities, and we're not hearing from public health messaging that you should not eat so many sweets, or try to lose 5 pounds or take a
Yeah.
walk every day. And
Yeah.
what you're saying, and I know it's true from having looked at the science, is that would save lives. But what we are hearing is stay alone in your room, be depressed, drink. You
Yeah.
can go to all the liquor stores you want. You can get pot in a lot of states. You can be comatose on the couch on Netflix, which is going to kill your immune system, and then you can take a vaccine. And so this seems like the opposite of good public health policy. So many things to cover. Let me ask a final question. When you see your patients, are there other categories of people that are getting sick or dying as a result of lockdown policies in your
Mhm.
practice? Did we cover the main categories, or are there other things you want to call attention to?
Yeah. So actually, one thing that I'll say is also I'm seeing a huge uptick in is things that you wouldn't actually really think of, and that's dental infections.
Yeah, I
So
just lived through this, but go ahead. Yeah.
yeah. So I'm seeing a big uptick in people coming in with dental infections and infections actually that were common before we had the invention of penicillin.
Mm,
So
God.
so so it's actually really scary that what's happening is because dentists closed down during the first lockdown in Ontario, and we're also have reduced access to them now because of huge backlogs. And the government and the media scaring everybody, saying that our emerges are all full of COVID and making people reluctant to come in for help. People end up with a toothache that they would normally go to the dentist for, and instead end up sitting at home, hoping it just goes away. And I'm seeing huge numbers of people coming in with their whole faces infected and red. I've seen infections that have gone down to the throat and almost closed off somebody's airway. We have to fly them out of town
Oh my God.
to see a surgeon.
Oh my God.
Um,
Are these
uh,
bacterial infections? Is that
yeah, bacterial infections that are easily fixable. If somebody comes in early to emerge, and we can treat you with antibiotics, or you go to the dentist early and have your tooth fixed, right, to prevent that infection from happening in the first place.
so this is
Uh,
almost like pre-20th century medical risk. This is what
yes,
people used to
yeah,
die of before there was penicillin and modern dentistry, right?
yeah, because they're afraid to come in for help. There are things that we have the tools to fix, but
Right?
the fear is keeping people at home. Um,
Understandable. And how
yeah.
serious is an untreated bacterial like dental abscess? It can go through your system and kill you, right?
Absolutely. Yeah, like it can go to your heart. You can get an infection in your heart. I've seen infections of the throat. I've heard from colleagues of infections even of the brain, right? If it just sits there long enough, it can get into
So
your blood and
So very
spread any.
serious consequences of lockdown, absolutely.
Yes.
And what
Yeah.
about breast cancer? Or like you can't do a breast palpation on telemedicine. Are breast and uterine cancers or women's cancers? Are you seeing people suffering more or at greater risk as a result of that?
I haven't personally seen them myself
It's not in
yet.
your
I'm
okay.
sure they're going to be coming. But yeah, like I said, all those referrals for those cancers went down. So they're going to end up being coming in late, often when it's too late.
And
Yeah.
with breast cancer, timing is everything, and early treatment is everything. And
Yeah.
lastly, what about violence? I mean, I know studies show that domestic violence is up 140, 150%. You know, women can't leave abusive situations. Men can't leave abusive. Children can't leave abusive situations. There aren't
Yeah.
eyes on the kids the way there used to be in school if a child comes in with a bruise or, you know, fearful or regressing or traumatized. What are you seeing at the ER? What forms of violence, if any, are exacerbated by lockdown at the ER?
So there's two parts of this. So one is, yes, I am seeing increased rates of abuse, and also it just becomes so much harder to establish safety plans for women or anybody who is undergoing abuse because of the restrictions. People have lost a lot of their outside support. They've lost their jobs. They're now stuck with this person. And their relationships might have been manageable before with a bit of distance and having outside support, but once that's lost, then often emotional abuse can escalate for sure. And the other part of it too is that we're actually like the numbers of reports of child and domestic abuse have actually gone down. And so there's no real reason to believe that they're actually going down. It's just that they're not getting caught. And that's because schools are out. Children aren't going to school. Those are all those safeguards that allow people and children to be seen and advocated for.
So it sounds like keeping distance doesn't keep human beings safe. Humans keep other humans safe, and human community helps keep people safe. Well, Dr. Phillips, so I guess final question, is it good public health policy to save, I guess is how it's always phrased, some lives from COVID, though the science doesn't show that lockdowns do that, and sacrifice all these other deaths, illnesses, suffering? Would you say that the costs are, is it good public health policy to cause all these other harms and presumably save some people from getting COVID by keeping everyone at home?
Yeah, I don't think so at all. And I think what the real solution here is personal choice, right? If you are at high risk of COVID and you are afraid of that, and that's your highest value is to avoid COVID, then all the power to you. You should be able to lock down. You should be able to isolate if that's what you really want. But people know their health best, and that's what, as a doctor, I can never tell somebody what's best for them. I offer choices based on my medical opinion, and they make the choices for themselves about what works best in your life, what fits your values. And so I have nothing against people who want to isolate at home and try to avoid this virus at all costs, but I don't think that's what most people want. And so there needs to be choice. These need to be voluntary measures, and people need to be able to regain that personal freedom over their own bodies and their own health to decide what's best for them and their own families.
Dr. Phillips, beautifully put. May everyone in the world, hear you, and may our policymakers act on your wise and experienced advice. We'd love to continue to talk to you as this horrific public health nightmare of lockdown, as well as the virus unfolds. And thank you so much for your time today, Dr. Phillips. And can people reach out to you? Is there somewhere to contact you if they want to talk to you?
Yes. So I'm on Twitter. My name is Patrick Phillips, MD. It's Dr. P at Dr. P _ MD. If they want to follow me on there, they can kind of see some of my messages.
And I should actually end by saying that I learned of you in a beautiful, moving tweet that puts you on the right side of history, in which you basically said, as a physician, I can no longer be silent because there won't be a career on the other side of this catastrophe. And I think we're all kind of many of us are reaching that conclusion. So thank you for your courage, being a true healer. People who do speak out can face pressure institutionally. So I hope that if you need support at any time, you come back and we will support you. The community, the world community will support you. And we're so grateful for your courage and your healing of your patients and your advocacy for them. Thank you, Dr. Phillips. Take care.
Thank you. Take care.